All right. They told us it wasn't going to happen again, but schools are shutting down and going virtual amid the rise in the Omicron cases. And that's despite the mounting evidence that COVID, even this variant included, isn't much of a threat to kids. A bigger threat to children is the mental health anguish shutdowns inflict on so many of them. It's so bad that even Biden's Surgeon General is sounding the alarm.
That their lives have been turned upside down. They haven't been able to see friends as often as they would. And that's taken a toll. It's why we've seen anxiety and depression rates go up among kids. Our children have been struggling for a while, and we have, I believe, a moral obligation to take action to support our kids.
All right, joining me now is Dr. Hemmati, board-certified MD and PhD research scientist, and Dr. Peter McCullough, an epidemiologist based in Dallas, Texas. Gentlemen, thank you for joining me. So, Dr. Hemmati, how is it that some of these parts of the country are resorting to the same policies that didn't work 2 years ago and have been so damaging to our kids?
Frankly, I think, in my opinion, as a parent, as a physician, as a scientist, and even as someone who's been a leader of the Reopen California Schools movement and LA School Uprising, which last spring lobbied successfully to get the schools to reopen this last fall in Los Angeles County, I can tell you that this makes no sense. And frankly, this is going to hurt children. It's going to be detrimental to them academically, socioeconomically, medically, and I'm not referring to COVID, but I'm referring to studies that have been published showing you have tremendously higher rates of diabetes and obesity in children. It was a great study published in Los Angeles by Kaiser Permanente that had access to a ton of medical records. You've got that anxiety and depression that was talked about, enormous spikes in suicide, and then we need to talk about the learning loss that occurs, right? The kids have missed an entire year of school already, and guess what? Those kids who can't afford to pay for private tutors, which is about 98% of them, they're the ones who really suffer. The ones whose parents can afford private education, tutors, etc., they're fine. And then we have to look at the lunacy of the whole concept of locking down schools. Children, as you've pointed out, right, are the ones who are the least likely to become severely infected or die. We know this. Now it's absolute fact. Back then in March of 2020, we didn't know who would get infected the most, who would die. We didn't know how it spread. We had no vaccines. We had no major studies. We had no good treatments. Now we have all that. Schools are testing kids left and right. They're masking them indoors and outdoors and all this. And even despite that, they're saying they may have to go back to these failed policies of the past. Again, if they do that, I think this is going to be one of the most criminal actions imaginable on the part of the school districts.
It's criminal and cruel. And so, Dr. McCullough, what concerns me on this is, 2 years ago, this might have made sense when we first started the pandemic, but we're 2 years in, and we've seen how horrible this is for kids. The screen time that they have, and as was just mentioned, the weight gain, the depression, the loneliness, the increased suicides. And we have a group of people who are liberals who say we follow the science. Well, wouldn't the science say it's safer to keep kids in school than to send them back at home and put them on their screens?
The scientific data now are really dominated by the Omicron outbreak. And this is a very tall but narrow peak. Now Omicron has actually broken through all forms of immunity, including natural immunity of the prior SARS-CoV-2 variants, and is breaking through the vaccines easily, as well as those who are susceptible. Now, the good news is, and I'm seeing this firsthand in my practice, it is a very brief and mild syndrome. And the children, if they get it, it can be less than a day of being a little bit warm with a fever, and it's over with. It's the mildest of all the SARS-CoV-2 syndromes. It's clearly been a shift. This is great news. Recent data suggests now that the Omicron will become the dominant variant because it's replicating 70 times faster than Delta, but it's providing back immunity against a Delta infection. So, in fact, Delta is going to have nowhere to go. We had the kids back at school during the Delta outbreak, which is far more serious than Omicron. Omicron's going to be so brief, it could be almost over with by the end of the Christmas break here, that the bottom line is the children need to be in school learning. A large fraction of them now are actually through it. And we simply just need to take prudent measures. Sick children should stay at home. If they become sick at school, the parents need to pick them up. Take this reasonable 1950s, 1960s common sense approach, and we can get through this together.
Gentlemen, I have 9 kids, and I see my young ones get masked up. I've seen the effort to keep them at home and try to have them learn online, and it is tragic the impact this has on kids. And I appreciate your guys' expertise and insight on this matter, and thanks for joining me on The Angle tonight.